Good morning, everybody. My name's Peter Daszak. I'm the chair of the Forum on Microbial Threats. It's a great pleasure to welcome all of you today to this fantastic 1.5-day workshop. We also would like to welcome the people who are joining us by webcast. So we should have a really global outreach from this workshop proceedings. I'm the president of a non-profit based in New York called the EcoHealth Alliance. We do research and outreach on emerging diseases, especially on zoonoses. And I think many of the issues we're going to talk about today have relevance to that. And that's really the expertise I bring to the forum. I would like to acknowledge the rest of our forum leadership, Mary Wilson and Kent Kester, who are here in the room. Can you raise your hands, please? Mary and Kent is on the phone and getting a coffee. And the staff of the forum, Cici Mundaka-Shah, Ayano Agawa, and Anne Tran, who work very hard to get these events organized and work to perfection. And of course, the sponsors, and there should be a list of sponsors up on the screen shortly for you to look at. So the forum has a series of members that represent agencies and other organizations, private sector and public sector organizations that support the work of the Forum on Microbial Threats. Now, the Forum on Microbial Threats is a part of the National Academies of Medicine, actually National Academies of Science, Engineering and Medicine, so it crosses the three different academies. It was formed in 1996 at the request of CDC and NIH in the face of a growing series of threats to public health. Threats here in the US that seem to emerge abroad and travel, and threats globally. Since 1996, the forum has provided a sort of structured opportunity for discussion of big issues around those threats. But we've also evolved a bit, and we've become more broadly focused on health threats in general that are related to microbes, chronic diseases, diseases of poverty, neglected tropical diseases, as well as emerging diseases and pandemic threats. The workshop has members from agencies, from industry, from non-profits like myself, from the philanthropic organizations that come together twice a year for workshops like this, as well as for our closed sessions where we debate these big issues. We think about what are the big threats that are coming down the pike that around microbial issues that affect health, that affect agricultural production, that affect our welfare and development around the world. Our membership is growing, it's becoming more diverse, and I think this reflects the sort of greater understanding about what happens globally with emerging microbes these days. They aren't just a threat to people in cities in the US, they're a threat to people all around the world, to our livelihoods and to our future development. They become endemic after they've emerged, they become chronic issues, and they lead to breakdown of social structure, security, and all of the development issues that go along with that. So the membership of the forum reflects that. Now, I just want to talk about the logistics of this workshop. It's an open public workshop. It's going to be webcast as well, so questions will be asked by members of the public as well as members of the forum and speakers. All of the presentations will be videoed and will be archived on the website, and the proceedings of this workshop will be published in 6 months. But there's a very important point to make, that this is not a consensus analysis of the opinions of the organizing committee or the Forum on Microbial Threats. And that's a very specific point from the National Academy's point of view, because we've not been vetted as to our biases and our opinions. So the report will be a description of the talks, of the presentations, and a report on the discussion that happened around those. Any views will be attributed to individual people in the room, not to the National Academy of Medicine or the Forum or the organising committee. So that being said, that bit of business out of the way, I'm really looking forward to the next 1.5 days. I've been involved in looking through the planning of this workshop and working with KG and others on the committee to to try and deliver something that's really going to sum up what the future is going to hold for us. And that's why the title has 2030 in there. So it's Readiness for Microbial Threats 2030. This ties in with the Sustainable Development Goals, which have a 2030 timeframe. This is far enough into the future that things will change, but not so far that things will change dramatically in a way that we can't at all anticipate them. So what we're trying to do today and tomorrow is to understand the current threats, try and get a handle on what's going to happen over the next 10, 12 years, and how we're going to deal with these threats in innovative and sustainable ways. So at this point, I'd like to introduce Keiji Fukuda, who is the workshop chair. Keiji is the director and clinical professor of the University of Hong Kong School of Public Health. And a good friend of mine, I've just came back from University of Hong Kong, an excellent workshop on emerging viruses. Really a hub of intellectual capacity in Southeast Asia. Keiji was formerly at the World Health Organization in several capacities, including as Assistant Director General and Director General for Antimicrobial Resistance. He focused on the Health, Security and Environmental Cluster, the Global Influenza Program, and prior to that was at the US Centers for Disease Control and Prevention as the Chief of the Epidemiology Section, Influenza Branch. He's also worked on diverse issues like chronic fatigue syndrome and various others. But more than that, Keiji, through his work over the years, both at the national level and the international level, has become somewhat of a public health diplomat. And really through focusing on the IHR, the international health regulations at the World Health, and the Pandemic Influenza Preparedness Program, try to understand how global governance can deal with pathogens that really don't respect borders, that don't respect social class, that can affect anybody and seem to spread around the world so rapidly now, they sort of get beyond our own societal boundaries. So Keiji has a lot of deep understanding on how governance has changed over the years and how it will change in the next 30 years. And I really look forward to hearing some of his input on that. So without further ado, I'd like to open the workshop and welcome Keiji to the podium. Cheers.